Thank you for watching my channel. Please subscribe and like. Now back to the news.
Bruce Springsteen has postponed all performances with the E Street Band for September as he undergoes treatment for peptic ulcer disease, the legendary rock singer announced. Springsteen, 73, shared a note on his Instagram page, telling fans that a concert scheduled for Thursday in Syracuse, New York, will be moved. He noted that medical advisors said he should postpone his September shows as he undergoes treatment for the disease. "Over here on E Street, we're heartbroken to have to postpone these shows," he wrote Wednesday. "We'll be back to pick these shows up and then some. Thank you for your understanding and support. We've been having a blast at our US shows and we're looking forward to more great times. We'll be back soon." His website listed the postponed shows, which included performances in New York, Maryland, Pennsylvania, Connecticut, Ohio, and D.C. Those with tickets to the upcoming shows will be notified about rescheduled dates. Springsteen also canceled shows in March and August. Springsteen will have a 2-month break to recover from his symptoms, as the tour does not have any October dates planned, and will probably pick up in November with performances in Canada. Springsteen has been on tour for the first time since February 2017. The tour drew controversy for steep ticket prices, which were linked to Ticketmaster's dynamic pricing system. In all, there are more than 60 dates planned across 51 locations. In March, Springsteen canceled shows in Connecticut, Ohio, and New York because of an unspecific illness. He also slashed a pair of shows in Philadelphia in August, citing illness. Springsteen, however, returned for 3 shows in New Jersey last week. What is peptic ulcer disease? Peptic ulcer disease is a break in the lining of the stomach or intestine caused by increased acid, said Judith Kim, a gastroenterologist at NYU Langone Health. It affects about 5 to 10% of the population. Peptic ulcer disease can range from mild to severe with life-threatening complications since ulcers can bleed, perforate, and cause scarring to block the outlet of the stomach, said Michael Goggins, professor of pathology, medicine, and oncology at Johns Hopkins University School of Medicine. Peptic ulcer disease is caused by bacteria, not coffee or stress. The main causes are a bacteria called Helicobacter pylori and use of nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, and naproxen, experts said. Some steroids and blood thinners have also been associated with ulcers, Kim said. The bacteria alters the stomach's protective mechanisms against acid to make the stomach more susceptible to acid-related injury, said Amy Oxentenko, a gastroenterologist at the Mayo Clinic. Most people are infected with H. pylori, usually from water, when they are young, said James Hartman Frank, a gastroenterologist with MedStar Health in Washington. It just takes a long time for it to form into an ulcer, he said. Smoking and alcohol can be risk factors for peptic ulcer disease, experts said. Stress does not cause ulcers, as many people commonly believe, though we do see stress ulcers in patients who have been in critical care units for prolonged periods, Kim said. Diet plays a minor role in peptic ulcer disease, Gabbard said. There's really no data that a lot of the things associated with ulcers actually have any cause or effect relationship with ulcers. Spices, acidic foods, coffee, they're not associated, interestingly, he said. Springsteen said on Tim McGraw's new show, Beyond the Influence Radio, on Apple Music that he takes his diet rather seriously since it helps him stay on stage longer. The biggest thing is diet, Springsteen said. I don't eat too much, and I don't eat bad food, except for every once in a while when I want to have some fun for myself. So I think anybody that's trying to get in shape, exercise is always important, of course, but diet is 90% of the game. The incidence of peptic ulcer disease increases with age, Kim said. There is similar prevalence in men and women, though stomach ulcers tend to be more common in women and ulcers in the intestine more common in men, Kim said. Peptic ulcer symptoms include pain and nausea. Peptic ulcers often cause abdominal pain and nausea, as well as discomfort when eating, according to the National Institute of Diabetes and Digestive and Kidney Diseases. People can also lose their appetite and weight, and may see blood in their stool if it moves down through the intestine, experts said. The peptic in peptic ulcers refers to the disease having to do with pepsin, a digestive enzyme, Frank said. Peptic ulcers can cause pain that can include the worst indigestion. Patients with pain usually feel the sensation at the bottom of their breastplate. A majority of peptic ulcers do not cause symptoms, some studies have shown, said Scott Gabbard, section head for the Center of Neurogastroenterology and Mobility at the Cleveland Clinic. Only 30% of patients with ulcers have those classic symptoms, and 70% of patients with ulcers may not even know they have them, he said. Sometimes maybe you just have anemia, you've lost some blood quietly, you don't know why, and it turns out that the ulcer is bleeding and causing problems that way, Goggins said. Peptic ulcer disease is treated with antibiotics and other medications. A physician may suggest tests to detect H. pylori, and if it is present, would treat it with a 2-week course of antibiotics and try to lower acid levels, Frank said, typically with a proton pump inhibitor, which decrease acid produced in the stomach. Ulcers without H. pylori are usually treated with proton pump inhibitors. The usual duration is about 2 months, and they have a very, very high healing rate, Gabbard said. Surgery is rarely recommended for peptic ulcers, experts said. Avoiding NSAIDs or other irritants such as tobacco and alcohol help recovery, Kim said. People with persistent and severe symptoms such as bleeding should get an endoscopy, which allows a physician to examine the upper digestive system for ulcers. They would try to seal it with various endoscopic devices to prevent or stop active bleeding, Goggins said. Preventing peptic ulcers. Some ulcers can be prevented by avoiding NSAIDs or by treating H. pylori infection early, before ulcers develop, Kim said. Avoiding smoking and alcohol can also help to prevent ulcer disease.